Hello, my name is Kirsten Combs, and I'm a graduate student in the Communication Disorders program. This is my thesis titled Speech-Language Pathologist Knowledge and Implementation of Thyroid Hormone Diseases and Allergies on Voice. My mentor was Dr. Amy Shollenbarger. About 5 years ago, I was diagnosed with hypothyroidism, thyroid nodules, and I began weekly shots for my allergies. And since then, I have noticed many changes in my voice. This led me to my research question of what do speech-language pathologists know about the impact of thyroid hormone diseases and allergies on voice disorders, and is this knowledge demonstrated in their case history questions for voice clients? My thesis has two hypotheses. First, that there will be a positive correlation between SLPs who know how allergies affect voice and SLPs who include allergy questions in their case histories. My second one is that there will be a negative correlation between SLPs who know how thyroid hormone diseases affect voice and SLPs who include thyroid disease questions in their case histories. A voice disorder is the difference between an individual's voice and what is normal for an individual of the same age, gender, culture, and geographic location. The term allergy is a chronic condition in which the bronchial tubes narrow and cause inflammation when exposed to a substance. In a study of 80 participants, almost half of them had a voice disorder, and they found that allergies were associated with diminished hearing and misarticulations. That I could find, there are no previous studies concerning SLP inclusion of allergies on case histories or their knowledge of allergies. A thyroid disease occurs when there are abnormalities in the thyroid gland's hormones that affects the gland's structure and/or function. These individuals present roughness, glottal fry, strained vocal quality, breathiness, and pitch disturbances. The participants in the study were SLPs in Arkansas that were ASHA certified. For the materials, a 24-question survey was generated using Qualtrics. The questions addressed demographics, thyroid hormone diseases and voice disorders, allergies and voice disorders, and questions regarding SLPs, case history, question routines for thyroid diseases and allergies. If the participant reported that they were not ASHA certified on the first question, they were then directed to the end of the survey. Also, an email list of SLPs were generated from a VESPA. After the survey was made, an email was sent to every SLP from the ABESPA email list, inviting them to participate in the attached survey. After 1 month, an automatic reminder was sent to those who had not completed the survey, and the survey stayed open for 2 months total, and then the data was analyzed. 387 certified SLPs accepted the survey, but only 284 actually completed it, meaning the total number of participants was 284. As you can see, most of the participants have been an SLP for more than 20 years, and most of them worked in a school setting or pediatric facility. Most of the participants knew which voice symptoms were caused by allergies, hypothyroidism, and hyperthyroidism, and most of the participants asked their clients who had allergies. However, very few asked them if they had a thyroid hormone disease, only 20. Of the 20, only half asked which disease the client actually had. Studies have shown that each thyroid disease causes different voice symptoms. The hypotheses of this thesis were supported by the data, and there is a need for more information regarding thyroid hormone diseases and allergies when treating voice clients. The correct diagnosis determines the effectiveness of treatment for our clients. A part of any health profession is improving our clients' quality of life, and studies have shown that these specific clients have a lower self-assessment of their voice, impacting their quality of life. So what are we doing for them? Here are just a few ideas to expand on this study in the future. First, a separate survey could be sent to endocrinologists and allergy specialists regarding voice symptoms and disorders to determine if these specialists refer their patients to SLPs for possible voice disorders. Also, a future study would be beneficial if SLPs were trained regarding how thyroid hormone diseases and allergies impact a person's voice, and at the end of the training, re-survey them to determine if their practices will change regarding case history questions and treatment. Endocrinologists and allergy specialists could also be involved to facilitate interdisciplinary practice. A third option would be a case study to be completed of SLPs co-treating with the endocrinologist or allergy specialist with the voice client. Here are the references that were used for this presentation, and thank you very much for your time.